So at this point, I'm going to ask Dr. Bu to come up and explain more about the chart that was up there with the modeling, because I know that some of you have been wanting to hear more information about our modeling.
Thank you, Governor. So as the governor said, almost since the earliest cases in the state, we've been working at the department and with partners both in the academic side and health systems and health insurers to build a model that would really let us understand what we should expect and how to predict what COVID-19 would mean for the state, especially when it comes to our most important healthcare resources that we know would need to be there for those most severely affected by COVID-19, and that's hospital beds and ventilators. And you've been hearing us talk a lot about those. You also, as the governor noted, recently heard from the national leadership in the White House about a model that they released. This model was focused on looking at the number of cases across the nation on a daily basis and using essentially fitting that to a mathematical equation to see how things are changing over time. So in the model that we're sharing here, this is slightly different from that because this is a model that's based on the actual dynamics of the way the infection works. This is really the standard way that we in public health look at an epidemic. It essentially models out a population that's susceptible to infection and then looks at as that population changes and becomes infected, we see these numbers start to rise. And then eventually it reaches a peak where there's nobody else to be infected easily. And those people are then removed from the model, either because, as most people are with this illness, they recover and they are better, or unfortunately, as 370 Louisianans have, they die and are no longer able to be infected. And that's why you see the model come down, or the lines come down. So essentially what this image depicts are a variety of scenarios for the state, depending on how we react to COVID-19 to stop the spread of the virus. Importantly, because we don't have a vaccine and because we don't have treatments that we know can stop COVID-19, our only weapon that we really have is social distancing and staying at home, not coming into contact with somebody with COVID-19. We know from international, national data, and state data that on average, if an individual has COVID-19, they're at risk of transmitting that to anywhere between 2 and 3 people, other people who can then go on to infect 2 to 3 other people. And so left unchecked, that leads to a really rapid rise in cases. And if we look at this graph, the thin red line there that says baseline depicts that scenario, where anybody who has the virus is really not doing much beyond potentially staying home if they're severely ill to stop the spread of the virus. And what you can see on this graph is that we're plotting the daily hospitalizations, number of new hospitalizations on the vertical axis, and then we're showing you time starting in March with our first cases and going through till March of the next year. So this is a year-long look. I mean, we look at that baseline. If we had done nothing, what we see is that by about early May, end of April, we would be in a situation, again, in Region 1, so these are the hospitals in St. Bernard, Plaquemines, Orleans, and Jefferson Parish, where they'd be seeing upwards of 3,700 to 3,800 hospitalizations a day. These are not total hospitalized. These are people needing to be hospitalized every day. And the day before that, it was 3,600. So these numbers are staggering. And then obviously at a certain point it would decrease. Unfortunately, we know that the capacity in our region would not be able to accept that. And so that's a situation where we have a lot of people showing up to the hospital, hospitals not having access to the needed therapies like ventilators that they need, and high levels of people unfortunately passing away, higher than we're seeing. So fortunately, though, we've taken measures and through the governor's orders to change how likely it is that any one person with COVID is to infect somebody else. Again, it's incumbent on us to actually act on those orders, to not go out and connect with other people or spread the virus. But that's what's depicted here on the other graph. So I'm going to first take you to the blue line, and that right next to it says effective social distancing. So if you remember, shortly after we had our first week of cases, we put in force social distancing rules. So this means people were encouraged to stay home when they were sick. They were encouraged to wash their hands, cough and sneeze into your elbows, and most importantly, stay 6 feet away from people. and not have big gatherings. Initially 250 people or less, and then we moved to 50 and now less than 10. So what that graph depicts is what happens to hospitalizations if we just did that. And what we can see is it not only decreases the peak, but it pushes it further away. So the peak moves now out to mid-May, and now rather than 3,700 or 3,800 a day, what we're seeing is about 1,500 hospitalizations a day in the New Orleans area, the Region 1 area. Again, that is a large number to sustain. Following that, a week later, we had the strict shelter in place. And again, now what we've added on top of what I just described is a situation where all of you are hopefully staying home and not going out unless you're an essential worker, not going out unless you have an essential visit. And that doesn't mean every day. That means as needed, going to get things like groceries, gas, going to the pharmacy. And while you're out, taking these same common sense measures, staying 6 feet apart, not bunching up in lines, gatherings down to less than 10. And importantly, for anybody who's sick or has symptoms, you're not leaving at all. You're asking somebody else to bring things to your house, and you're really staying in place. In that scenario, what we see is even further pushing out the peak and really decreasing the number of new hospital admissions. There we see the peak is being pushed out really to early July. And at the peak point of admissions, we're seeing about 500 a day. Again, that is a large number of admissions for the hospitals to sustain, but much different than seeing 3,800. So that's why we've been pushing so much for this policy, because it's really what's going to allow us to continue to push the day away to no vents, push the day away to no beds, and allow the surge activities that the governor's put in place to be able to absorb that extra admission strain that we're seeing. So if I go back to the chart, the black bold line that says current midpoint is showing you where we currently project that we are. And this is because COVID-19, we know people who have this infection can be infectious for up to 2 weeks. And so we really have to give a 2-week period to see these policies actually have an impact on numbers. And so we're sort of tracking along as people have been doing the work that you saw with the heat map of staying at home, not going out and coming together. And so there we are somewhere between that really scary scenario with the red line and the first scenario that we'd like to achieve, which is this blue line. We have indications that we continue to see movement in that direction, especially in those areas that correlate with that map, the areas that overlap with the map that the governor showed you: Orleans, Jefferson, East Baton Rouge, Bossier. We're seeing those areas are really showing the impacts of actually limiting their contact with others. And our hope is that if we can continue to do that, and more importantly, spread that to the rest of the state so that everybody's taking this seriously and taking measures in their own neighborhoods, we will see that line continue to get closer and closer to the purple line. We will push away the peak. We will decrease the number of daily hospital admissions and make it more likely that we're actually able to have the surge measures that the governor's put in place actually be able to absorb those extra admissions. And we're showing you hospitalizations here, but as the governor said, the things that we're tracking through this model are hospitalizations and deaths. And we want to avert deaths most importantly as well. And so that, thank you, Governor.
Thank you. So at this time, we will take your questions, and I'm assuming you're going to have a number of questions for Dr. Bu on the modeling. Yes, ma'am.
So the way I'm reading that, we don't look very good, I guess is what I'm saying. Where we are right now, we're not even close to the social distancing, yet alone where we want to be in the strict shelter in place. It sounds like we're kind of not in a good place right now.
Yeah, and I don't want to speak for the governor, but I think that's why, you've heard every day that he comes out to speak that this is still very concerning. This is still something that we're here at GOSEP every day looking at these numbers, talking about what measures can be taken. I agree with you. It's not good, but there is a glimmer of hope in that we can actually act to change where that slope is. We can act to move this graph further over, away from us and down. And that's incumbent upon us, and only citizens, we as citizens, can do that.
What does the midpoint projection mean that the peak would
Yeah.
be?
So I mentioned that at baseline we think that one individual could infect between 2 and 3, we'll say 2.4 people. That current midpoint is saying that one person right now with current measures is on average infecting about 2 other people. So we've nudged, but we need to go much further than that.
And that doesn't sound like a big difference, 2.5 to 2 people, but when the growth is exponential, those small differences make a really big difference in the aggregate and over time, because it isn't just that an individual might infect 3, those people could turn around and infect 3 each and so forth. But if you get it down to 2.4 to 2 to 1.7, the lower that is, the better off you are. And I guess the thing that I've been trying to communicate consistently is that really, even under our best case scenario, it is an extremely tough situation for our hospitals. And we do expect that at some point we're going to exceed our capacity as it relates to beds and it relates to ventilators. And understand, we're comparing beds to COVID patients. You still have non-COVID people who have to be in the hospital. Heart attack victims, stroke victims, motor vehicle accident folks. There's all sorts of folks who have to be in the hospital. And so, and by the way, some of those people require ventilators too, and intensive care beds. And so this is really serious. We're doing this every way that we can to try to get the attention people to get more compliance so that we get the lowest transmission rate possible. And you know, I'm gratified that it appears over the last several days the talking points that we've been delivering here have been echoed and reinforced by those coming out of Washington. So there is no daylight between what we're saying to you in the state of Louisiana and what's being said coming out of Washington, D.C. Yes, sir.
So going back to that strict shelter-in-place line, that's not you implementing stricter shelter-in-place rules. That's residents strictly following them?
That is if the people follow the order strictly that is already in place.
So
yes.
More so than they're doing now.
Yeah. So, I mean, that tells, yes. I mean, and we can always have better compliance, even in places like New Orleans and Baton Rouge and Jefferson and Bossier, where it's better than elsewhere in the state. We know that it's not 100%. But so everybody can do better. But if we did adhere in a real positive way to the current orders around sheltering in place, keeping the schools closed and that sort of thing, we would be down along the purple line. And so where we are right now is somewhere between the worst case scenario and the best case scenario. But to the degree we get compliance, we start moving and keep moving and get closer to the best case, and less people will die. That it is really that simple, because sometimes we can kind of lose ourselves in the numbers and the graphs and so forth. But to the degree that people comply with the orders, then less people are going to die. It is literally that simple. Jeff.
Would that mean the strict shelter in place would be in effect all the way to September, October, based on what that graph is showing?
Well, it would have to stay in place in order for that line to follow out all the way. Now, look, we don't know that we're ever going to get on that graph, and so we don't know whether we stay on the purple line or on the blue line or somewhere in between them. And that's why we have to continue to monitor where we are, and we will make announcements about what the future looks like based on where we believe that we are. And by the way, the underlying assumption for at least one of the models shown by the president the other day had the mitigation measures staying in place for the month of May. And I know his current emphasis, and by the way, my order too, it takes us through April the 30th. But in order to keep the deaths in the country between 100,000 and 240,000, which is what they were talking about, that assumes that the full mitigation measures stay in place through the month of May for the country.